The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 38 85 2397 or visit www.bahrainmediacity.com.
Good evening everyone. Welcome to a brand new episode of BMC Global Live Hilal Health World, Nothing But Lifestyle. I'm Anupama Menon, wishing all the viewers a very happy new year. We have stepped into 2023. It's a fresh start, a great opportunity to make a promise to ourselves that we will make our health a priority. The greatest gift that you can give yourself and your family is a perfectly healthy you. In this talk show Health World, we have expert doctors from various fields providing guidance and valuable information to assist you all on your journey towards good health. So wishing you all lots of happiness and good health in 2023. Today we are happy to have with us Dr Saritha, General Dentist from Hilal Hospital Muharraq. She comes with a wealth of experience, over 15 years of experience in India, Saudi Arabia and Bahrain. And today the topic of discussion is healthy gums and teeth for good oral health. So Doctor, welcome to the show and thank you for joining us.
Thanks,
So
Anupama.
before we begin off, for the benefit of our viewers, can you please throw light on this topic, about oral health and healthy gums? If you could just explain to the viewers what exactly it's all about.
Oral health is not just an attractive or beautiful smile. So good oral health is important for the healthy teeth, gums, and overall well-being. So it will also help to prevent tooth decay, gum diseases, bad breath, and many other dental problems.
So what exactly is bleeding gums? Because a lot of us face this problem, you know, when we brush our teeth, we can see a little bit of blood when we spit it out. So is this the same as bleeding gums? Can you please elaborate on this one?
See, healthy gums don't bleed. So if you see blood when you brush, that could be an early sign of gingivitis.
Okay, so bleeding gums is called gingivitis in
Yes,
medical
bleeding
terms.
gums is also known as gingivitis.
Okay.
It is caused by the buildup of the plaque, a thin film of bacteria at your gum level. So this bacteria is not removed, like this will lead to red, swollen or inflamed gums. And initially for many people they will not feel any symptoms. So spitting blood when you brush, that is an early sign. So if you notice any redness or swelling or anything, this can be treated with early. If you detected this early means we can treat it with poor oral hygiene and deep cleaning, and in some cases we do the gum surgeries and bone graft.
So it requires medical attention. If you
Yes.
see gum bleeding for a long period of time, this could lead to further gum diseases and
Yes, if it is not
complications.
treated, this will lead to gum disease. Eventually tooth loss also may happen.
So bleeding gums, this happens only while brushing the teeth, or could it happen randomly also? Can bleeding occur from the gums, you know, even when you have not put any pressure, even when you are not brushing? Is that normally seen?
So in early gingivitis, usually you may notice like bleeding when you brush, and in later stages sometimes even without brushing also you may notice the bleeding from the gums.
So it can occur.
Yes, yes.
And you spoke that if it's left untreated, it could lead to gum diseases. So what are the various gum diseases that are there?
Actually, when gingivitis, if it is untreated, it will develop into periodontitis. It's called gum disease. It is a serious gum infection that will affect the soft tissues and bones that supports the teeth. If it is not treated, that eventually you may your tooth may lose. You may feel loosening of the teeth.
So gum disease, what you're saying is, can actually lead to loss of teeth as well. So it should be taken very seriously, I guess,
Yes.
by everybody, because normally when we talk about oral health, we tend to focus more on caries and cavities. So I guess gum health is equally important. So doctor, what are the symptoms of gum disease? How would a patient know that he or she is suffering from a gum disease? Other than minor bleeding, because normally we tend to ignore it. This does happen quite a few times, you know, while we are brushing. We feel maybe we have put some extra pressure and that's why it's bleeding. So what are the red flags to look out for?
Like symptoms, we usually you may notice initially redness, painful and swollen gums. Then of course gum that bleed during and after brushing. You may feel receding gums and sensitive teeth, painful teeth, like pain when you are chewing. These are the common symptoms
So
people
receding
may
gums
experience.
you feel would be visible, right?
Yes, yes.
When you look at the teeth, you can make out that the
Yes, if you
gums
have
are
receding gums, you may experience sensitive teeth.
Okay.
And tooth loss. And the main thing is formation of the pockets, that is a space between the gums and the teeth.
Okay. So there could be bacteria deposits
Yes,
there.
yes, bacteria deposits, and it will lead to periodontitis.
So what are the risk factors for gum diseases?
Yeah, there are many risk factors. Main thing is the smoking, poor oral hygiene, diabetes, then taking some kind of medications that will lead to dry mouth and hormonal imbalance. If you have any malaligned teeth or defective filling, this will also it will increase the risk of periodontitis.
Okay, so smoking is one of the main
Smoking is one of the main
risk
causes for
factors.
the
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
So doctor, does bad breath occur because of gum diseases? Because a lot of people face this issue of bad breath. So how do we tackle that? Is there any connection between gum diseases and bad breath?
Bad breath is also known as a halitosis. We all get it from time to time. So the main causes are like tooth decay or food trapped between your teeth and dry mouth and heavy coating on the tongue. These are the main causes actually. Then other medical conditions such as gastritis, oral and throat infection, and if you have oral ulcers, this also lead to bad breath.
Doctor, could you please talk a little bit about tooth decay, because I'm sure a lot of our viewers would like to know about that. You know, what are the various aspects of tooth decay, how we can prevent that? If you could just throw some light on that topic.
Tooth decay happens when bacteria, it will form a sticky layer over the teeth called plaque. Over the period, it will destroy the outer surface of the enamel. And initially in early tooth decay, you may not experience any symptoms, but once the decay goes deeper, you may feel hole in the teeth, that is a cavity, and you may experience sensitivity when you drink cold or hot.
Very hot or cold.
Yes, cold or hot, then like a pain. So the treatment depending on the severity of the tooth decay. If it is an early decay, we do the fillings. Once the decay goes deeper, you will get pain or sometimes inflammation, swelling or abscess. In such condition, we advise to do the root canal treatment to save the teeth or remove the teeth.
So I think that's why it's very important to pay regular visits to the dentist. You know, whether you're facing problems or not, it's always, I think, advisable to just get a checkup done, so that if there's any cavity forming, you can treat it rather than going for the root canal at the onset itself.
Yes.
So how often would you suggest, if once in 6 months or every year?
Yes, every 6 months we used to advise the patient to visit a dentist, so that if anything is there, you can detect early and you can do the treatment. Maintaining good oral hygiene is the most important thing that we can do it for your gum and the teeth.
So many people have this problem of missing teeth. So how is that treated? Are there any treatment options available for that?
Missing teeth, certainly it will affect your appearance,
overall
and
appearance,
smile,
yes,
and chewing, and mainly it will affect speech also. So treatment options are various treatment options are available. The most common treatment option is the dental implant. Implant is the most common way to replace the missing teeth. It is a small titanium screw that we surgically place inside the jawbone, and over the implant we put a crown. And next is dental bridges. This is also again a permanent way to replace the missing teeth. So we take support from the adjacent teeth and we do the dental bridges. And next treatment is the removable partial dentures. So removable means this removable partial denture we can do if people are having single, multiple or even total tooth loss. We can do the removable partial denture. This is the most affordable way, treatment for the missing teeth.
The removable ones are the affordable ones.
Are the most affordable one for the missing teeth.
But patients can also go for permanent tooth implants, so there's no hassle of removing it and putting it on again. It will be there forever.
Yes, fixed means and no need to remove it actually.
Okay. Doctor, before we wrap up, any takeaway message for our viewers, any tips that you would like to share with our viewers to maintain good oral health and hygiene?
Brush your teeth twice a day using fluoridated toothpaste and a soft bristle toothbrush. And try to change your toothbrush every 3 months or once the bristles are frayed. Flossing helps to remove the food particles that left behind the teeth even after the brushing. Then clean your tongue with a tongue scraper. That will also lead to bad breath. You can use mouthwashes and try to avoid carbonated beverages and more amount of caffeine. That will lead to staining of the teeth and as well as it will causes erosion of the enamel. Then using tobacco products that will not only harmful for the lungs, it is 4 times greater the risk of having oral and throat cancers. And try to include more salads and fibrous food, crunchy fruits or low fat dairy products. Then try to avoid stress, because being stressed will release a stress hormone that will causes inflammation throughout the body as well as the gums.
So thank you so much, doctor, for those very useful tips. I'm sure the viewers will find them very useful and handy. Thank you for taking the time out to be with us today.
Thank you.
So friends, a smile is the most inexpensive and the best accessory that you can wear. So please do take care of your oral health and oral hygiene. Gum diseases are not meant to be taken lightly. Please do pay attention to bleeding gums and visit a doctor if you feel that there are red flags and symptoms. Wishing you all once again a very happy new year. May 2023 bring lots of happiness and good health to all of you. Till we meet again next time, this is Anupama signing off. Good night and stay safe.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 38 85 2397 or visit www.bahrainmediacity.com.